Hello everyone, you're welcome back to my YouTube channel. If this is your first time on my channel, you're welcome. I am Dr. Rumi and this channel focuses on everything women's health. If this is the kind of content that you're interested in, please do well to subscribe to this channel. Hit the notification bell so you'll be notified every time I drop a new video. Like my videos, share and comment on my videos. On today's video, I'll be teaching you everything that you need to know about breast cancer. And this was inspired by a video I made earlier on how to do a proper self-breast examination. I got some questions and comments that I would like to address on today's video. Now, if you've not seen that video, please pause this video, go back, watch the video, and come back to this video. So the questions I got: 1. What are the causes of breast cancer? Why the excessive awareness of breast cancer? And the third was a comment, and it was saying that teaching on breast cancer causes undue anxiety in women, and this teaching should be kicked against. So I'll be addressing all this today. So first things first, what is breast cancer? Breast cancer occurs when healthy breast tissues become abnormal, grow out of control, and become tumors. Now, most times people think that cancers are those things that just flew from nowhere, implanted themselves in whatever organs that they have found, and then just start causing problems. It's when the healthy tissues in that organ become abnormal. Now, why the excessive awareness about breast cancer? It's because breast cancer is the second leading cancer killer in women worldwide. Now, it is said that 1 in 8 women have an increased lifetime risk of having breast cancer. So you can see that this is very, very, very common, and it can never be overemphasized. Now, what are the causes of breast cancer? Unfortunately, there are no known causes. However, there are risk factors that are said to predispose certain individuals to having breast cancer. One is an older age. So women older than 30 years are more likely to have breast cancer. However, it can be seen in women who are less than 30. But it's more likely seen in women who are older than 30. The second is a family history of breast cancer. So assuming an individual whose mother had breast cancer, or whose sister has breast cancer, or a mother whose daughter has breast cancer, has a higher risk of having breast cancer. Thirdly is women who have uninterrupted exposure to estrogens. Now, who are these women? Women who have never been pregnant in their life, women who started seeing their periods less than 8 years of age, women who attained menopause later, that at the age of 55, or women who became pregnant for the first time in their life at the age of 30, or women who do not breastfeed their babies. So here for breast cancer, breastfeeding is protective against breast cancer. And then women who have previously had breast cancer in one breast. Now these women can later in life develop breast cancer in the unaffected breast later. Women who have cancer in other organs, so women who have cancer in their ovaries, women who have cancer in their uterus may have breast cancer. Another risk factor: women who are obese, women who take excessive alcohol, women who smoke. With all this, most times, these particular women may not have breast cancer. Now, what are the things that you will see that will make you go see your healthcare provider to help make this diagnosis? Now, 1 is a painless lump in your breast or in your armpit. Most times, people have this painless lump, and because it's not painful, I'm fine. They wait till when it starts paining them. When it starts paining you, it's a bad sign. Now, the next sign is a skin change in your breast. So when your breast become red, when it becomes swollen, or when there are dimpling effects like the back of an orange, those tiny small holes. When you have that in your breast, you need to go see your healthcare provider. Another sign may be a change in the shape and in the size of your nipple. Now, Another change to now this the change in shape and size of the nipple will become smaller, or it will go back inside into the breast where you can't even see the nipple. Or you could have discharge from your breast. This could be pus, that's from the nipple. This could be pus or even blood. Another sign is when you have swollen arms, like when your arm is swollen and then that breast too is swollen. So when you see these things, it is advised that you go see your healthcare provider. Now, who are the healthcare provider? Any professional doctor or a nurse. Now, when you go see them, we do something called clinical examination for you, which is where this healthcare provider examines your breast. Now, after the examination of your breast, they may send you for an imaging test. Now, this could be a mammogram or a breast ultrasound. Who do we send for mammogram and who do we send for breast ultrasound? Women who have attained menopause, that is, women who are no longer menstruating, will be asked to do a mammogram, and women that are still seeing their periods will be asked to do a breast ultrasound. Now, a lump was seen in your breast, a professional examining it, we've asked you to go for an imaging. The next step would be to take a sample from that breast so that it can be taken to the lab and so that we can check what if you have cancer, what type of cancer you have, and if it is truly cancer that you have, because not all lumps in the breast are breast cancers. Now, that is for people that have. So for the next part of this video that said that teaching on self-breast examination increases or causes undue anxiety in women. Now, self-breast examination remains the number one screening for breast cancer. Now, because of the way it is common, if you don't educate women on how to do a proper self-breast examination, that's why the word proper, because sometimes people don't know how to do this examination and then when they just check their breast, they are afraid. But when you can do the proper self-breast examination and there's nothing there, you're okay. It's better to be safe than sorry. The complications to breast cancer is something you don't even want for your enemy, not to talk of your relative. So teaching, in as much as yes, it increases anxiety, but like I said, it's better to be safe than sorry. And even after doing this, it is advised that you go see your healthcare provider so that they would tell you properly what you have. And then the next step to this is after the diagnosis has been made, your healthcare provider would pick the best and preferred treatment for you. So I hope that today I've taught you the necessary things that you need to know about breast cancer. Thank you very much and do have a lovely day. Bye.